Pharmacology Basics. When we start with the basics, we start with drug names. There are chemical names, but we don't get into chemical names in nursing. There are generic names like acetaminophen and furosemide. Those are the ones that we like to have on the NCLEX, right? And actually, generic names are what are on the NCLEX. Then there are brand names or trade names, same thing. And that's what the company puts on there to put their own brand on that medication. Things like Tylenol and Lasix. When we talk about pharmacology, we talk about the pharmaceutic phase. This is a phase which involves disintegration and dissolution. Sometimes that means we're chewing it. Sometimes that means we might crush the meds. Things that are not safe to crush are anything that are extended release, anything with an enteric coat, or anything that is a capsule. The pharmacokinetic phase deals with absorption, distribution, metabolism, and excretion. Absorption, just quite basically, is the movement of that drug into the body and to its tissue that it is affecting. Distribution is how we move it there from wherever it's entering to wherever it's needed. Often happens in the bloodstream. Metabolism is the building up or breaking down of any of those products. Oftentimes that means we can build them up or break them down into things that can be utilized within the body. Maybe they are made bioavailable. Maybe we've broken them down enough so that they can be excreted. Excretion involves getting rid of the drug out of the body and is oftentimes done through the kidneys. Now, it can be done through the skin, the lungs. It can be done through the GI tract. Oftentimes, there's some sort of metabolic process that needs to happen in the liver before it can be sent out those other ways. So, excretion can be a fun thing to talk about. The half-life is the time it takes for a drug to decrease by half. It reflects the metabolism time. Decrease in liver or kidney function will generally prolong half-life. When we talk about onset, peak, and duration, onset is the amount of time for a drug to demonstrate therapeutic response. Therapeutic response time, then, is the amount of time to reach full therapeutic response. In our case, in our circumstance, when the therapeutic response is at its highest, we're going to call that peak. So a peak level, also called full therapeutic effect. Duration of action is the amount of time the therapeutic effect lasts. Side effects are anything that result from the drug that wasn't the intended effect. Adverse effects. When the side effect that is harmful. Allergic response often involves antihistamines, a response where the body starts an attack plan. Oftentimes, this will involve things like hives or little bumps on the skin, redness, inflammation. It can occur all the way up to an anaphylactic response, which we'll talk about a little bit later, and throughout your nursing program. Tolerance, cumulative effects, and drug toxicity are important. Tolerance is the decreased response to a drug over a period of time. As the body seeks homeostasis, higher levels of a med are needed. Cumulative effect is the amount, when the amount is greater than the rate it is excreted, you get an accumulation of that product within the system. Drug toxicity happens when toxic effects happen with excessive dosages. Drug-food interactions can be quite important as well. So we'll look at those first. Grapefruit juice can have toxic effects by causing the med to be metabolized slower and sent out of the body slower, and so it builds up. And so it accumulates and becomes toxic. Things like Zoloft, Allegra, and Procardia. Dietary tyramine, things like Marplan and Parnate, those can result in hypertensive crisis if taken with food that has tyramine in it. Milk and tetracycline can, you can see a reduced therapeutic effect in the tetracycline because the absorption is decreased. Avocados and spinach and kale can cause a problem with Coumadin, resulting in a reduced therapeutic effect. Then high-protein meals can actually affect levodopa, causing a sudden loss of therapeutic effect. Precautions and indications are important because precautions are something you watch out for. Contraindications are something that say, do not use this if this is true. There can be drug-drug interactions. Sometimes drugs can be agonists, and they can cause either a physiological process or another drug to work even better. Sometimes they can be an antagonist, and they can work against physiological processes or against other drugs. Then we have two concepts here that are kind of neat, that are some drug-drug interactions. One is an additive effect. If I have one drug plus one drug, and 1 plus 1 equals 2, meaning the two drugs add up and have the effect of the added sum of the two, then I have an additive effect. However, if I took a kid and stuck them on a trampoline, they would jump much higher than if I just added them on top of the trampoline. And that's how most drug-drug interactions work. It's called a synergistic reaction, and it's way more than the sum of the two that results. Thank you for joining me in this adventure.